All right. So this is actually part two of our initial conversation with Dr. Kevin Taylor. I'm going to let him introduce himself. We are privileged and honored to have him. And I promise you that the next 30 minutes or so, we are going to learn a lot from the organizational aspect of the impact of certain factors on burnout, on wellness, on resilience, and what we can do. We talk a lot about individual things at Vital Signs, Vital Skills, along with organizational, but what better way than to hear it from the man who is responsible for that? And I will let him introduce himself. So Dr. Taylor, thank you so much for joining us. Can you introduce yourself to our audience, please?
Thanks, Naeem. My name is Kevin Taylor. I'm a primary care internal medicine physician working in Ann Arbor. I have several years of experience as a physician leader, recently working at the American Medical Association in Chicago in their practice sustainability and professional satisfaction department as the director for organizational transformation. So delighted to be with you today.
I do want to thank you for your time. I know a lot of people, I know you and I have had conversations, a lot of people will benefit tremendously. But to set things in motion, maybe we can focus on what you wanted to discuss today.
So I'd like to talk about organizational culture, the efficiency of our practice as key building blocks to developing professional well-being programs in our health systems, the importance of measurement using validated instruments, and then some around coaching and developmental programs that have been effective in helping practices and health systems move forward in developing these programs for professional well-being.
Okay, so there are three major points that we will talk about. And is there a model that you would like to follow, a model of wellness, so to speak?
The model of wellness that I think we're all very familiar with is called the Stanford Wellness Model. It has three pillars: the culture of wellness, efficiency of practice, and personal resilience. We believe that two of those components are most impactful in promoting clinician well-being, and that is the culture of wellness and efficiency of practice. And I would like to share a little bit more about those today.
Great.
So in regards to the organizational culture of wellness, there are two, there's a lot to that. I want to focus on a couple of important success factors. One is measurement and the other is leadership. As you know, any organization, if you're really wanting to accomplish some successes, you're going to need to be able to measure it. We know that you can't manage what you can't measure. As it regards to professional fulfillment and wellness, there are 4 validated tools that are being recommended in the healthcare arena. Mini-Z, which is a tool that we have at the AMA, the Maslach Burnout Inventory, and the Mayo Wellbeing Index, and the Stanford Physician Wellness Survey. These are surveys that are available for organizations so that they can monitor, at least on a yearly basis, and some do it more frequently, the professional satisfaction and well-being of their physicians and the level of burnout. I would recommend there's a website, the AMA Joy in Medicine Recognition Program has a website that provides a roadmap for health systems, for health system leaders who want to implement programs and policies that actively support physician well-being, and you can learn more about these validated tools on that website.
Great.
Let me talk a little bit more about leadership as well. The other success factor, I think, with a culture of wellness. Leadership matters, and colleagues from the Mayo Clinic really identified this. Dr. Steve Swenson and Tate Shanafelt have published on the impact of leadership in driving health professional well-being, and they identified 5 key behaviors that our physician leaders should be able to demonstrate and could learn to improve on and those are to include, to inform, to inquire, to develop, and to recognize. Let's talk a little bit about those. So including is creating that psychologically safe environment where your colleagues, the physicians that you lead, can approach you, where you treat everyone with respect. To inform is to be transparent, to provide them the information that's important for them as we're all moving forward in our health systems with lots of changes. To inquire, consistently soliciting their input, opportunities for improvement, issues that are working well or not so well. To develop, knowing that for each of us, we have our own professional goals and aspirations, and as leaders, we need to know what those are and to help to nurture and support our colleagues to achieve those goals. And then the importance of recognizing, expressing the appreciation and gratitude for the work that they're doing. As I indicated, what they've shown is that leaders who are able to do this and do this well can decrease burnout by up to 10% amongst their colleagues, and can increase the sense of satisfaction by 50%. So leadership matters, and the behaviors and actions of our leaders is one of the single most impactful drivers for a healthcare professional's sense of well-being and fulfillment.
I would comment also, these are, at least we know from a personal standpoint how important this thing is, how important these 5 steps are. And I would venture to also say that those who score high on emotional intelligence usually excel in all of these 5 realms, if you will. So it's very interesting. And when you talk about efficiency of practice, what does that entail?
Yeah, let me give you a story. I was working with a health system a few years ago where they were struggling with wait time. It's an issue that we all kind of grapple with at different times. And it affects, obviously, the patient experience, but the staff as well, and the physicians. They get frustrated as the day gets longer and longer. So what they developed, what they came together and they just brainstormed, and they came up with this very innovative idea of using stoplights, green, yellow, and red colors. And they had actually electric green, yellow, and red lights at different key areas in the office, at the different pods and in the central administrative area. And as physicians were on schedule, the lights would be green. If the physician started to get behind schedule, say by 5 or 10 minutes, it would turn yellow. And if they got behind the schedule an entire visit length, 20 minutes, then it would turn red. And there was a certain responsibility of the team depending on what color of the lights. So if it was yellow, there would be some efforts made to assist the medical assistants. If it was red, certain individuals would be dropping their work and trying to go to assist the physician to get back on schedule. And so it's an example that an office practice was able to come up with to address a specific problem around efficiency of practice. And there's ample examples of this. The AMA has a great website called stepsforward.org, which provides numerous examples of organizations that have implemented various systems that create efficiencies in practice, from pre-visit planning to team documentation to prescribing over a 15-month time frame, and so forth. So I'd encourage you to go to that website. But what it really references is that there are certain things in our control at the practice level that we can manage. Those pebbles in our shoes that are frustrating, irritating, or maybe it's the quality of care for our patients that we could continue to improve. And how can we as a practice kind of take control of that? And so this whole idea about improving efficiency of practice recognizes that there's a sense of lack of control that's a strong driving force in the development of burnout among our docs, among our physicians, and our our care teams. And so what can we do to try to give that control back to our physicians and our teams, a sense of what I call internal muscle, so that they can identify problems and come up with some solutions and bring those to completion. Mayo Clinic, I shared the Mayo Clinic Leadership Index. They have a great coaching tool that they use to really assist their physician leaders in being able to do this type of work. And it's called Listen, Sort, and Empower. And it's simply how that works is they will bring their healthcare teams together and just have an active listening session. What are the things that are the pebbles in your shoes? They'll identify the ones that they feel like the team has control over, because some of this stuff is really at an organizational level, but there's a lot that's within the control of the team. And then they'll prioritize which ones will seem to be having the best impact, do an effort impact kind of assessment. And from that, identify one or two, maybe three types of initiatives that they're going to move forward with. And so they're listening and they're sorting, and now they can empower them using tools like the Model for Improvement, which is an easy model to learn, developing an aim statement with a SMART goal for the specific problem you're trying to improve. So say you are trying to improve wait time, so you're going to look at the cycle time, the amount of time the patient is in the office from check-in to check-out as your core measure, and you want to improve that. Maybe you want to decrease it by 50% over the next 3 months. That becomes your SMART goal. And then you bring the team together and you start, say, brainstorming. What are some change ideas that we could do to really address this issue, to really achieve our SMART goal? Those change ideas are hypotheses, really. It's part of the scientific method of process improvement. And so you can have specific measures to each of those change ideas. Then moving forward every day, looking at the implementation of your change ideas, how that's potentially influencing your outcome, the cycle time. You can identify specific change ideas are really impactful, and so you'll make those standard of work in your practice. It's all part of giving control back to the team to address specific irritants, to improve specific disease management programs. It really helps to improve a sense of purpose and decreasing burnout among your teams. Excuse me, I just want to share an example of an organization that's been doing this at Atrius Health in Boston. Dr. Kareem Awad, who's the medical director for clinician wellness, has developed this type of program, the Listen, Sort, and Empower program. And he calls it the LPI, the Local Practice Improvement. They've found in doing this that they've actually had an improvement in satisfaction of their physicians. They've had a decrease in burnout among their care teams that are doing this. Our colleagues at the University of Washington have developed a half-day quality improvement boot camp that is doing a similar type of thing, teaching the teams how to identify specific issues and developing an aim statement, using various change ideas to implement to improve on their processes to achieve their aim statement goals. So these are programs that are currently in place that are working really well across the country, that are helping practices to learn how to solve the problems within their control, and in so doing, really decreasing burnout among their teams.
So that really targets one of the three things that Christina Maslach talked about as far as the drivers of burnout, which is lack of control is one of them.
Yes.
And then
yes.
also tackles unmet expectations. And in talking about resilience, if you give people goals that they can achieve with success, that gives them, allows them to be more resilient, because success breeds resilience. Okay, I'm doing something.
No.
So it's very interesting, and obviously it works. We know it works.
Yes.
Um, on that note, also, can you share how going through the change impacts your care team experience, well-being, satisfaction? What happens to them?
Yeah, let me share a story. I was talking to a chief medical officer recently who was challenged, as many of us experience at various times in our role as leaders, trying to bring your colleagues through a transformational change, going from a current state to a future state, which requires them to have a kind of a new mindset. That journey often is challenging because there's a lot of resistance among our teams as we go through that. And the chief medical officer was meeting with a group of specialists who recently joined their health system and wanted them to increase their referral base. The organization had made a new strategic plan to go to another hospital, and they wanted to provide this specialty referrals to that hospital. So this was made a lot of sense from a business case and strategically to the physicians, but they were strapped. They were already tapped out in terms of their capacity. So it was a concern. The physician, the leader, the CMO, was struggling because he wanted to respect their autonomy, their ability to have a sense of agency and a voice, but also needed to get them on board with the strategic direction of the organization. And this is an ongoing challenge that we deal with as we manage change. And Daniel Pink, in his book Drive, identifies the three elements that are core internal motivators are autonomy, mastery, and purpose. And he notes that these three internal motivators are often stronger than external motivators like our compensation or our job title. So as leaders, we're challenged with balancing the need to lead our teams through change at the same time to respect their autonomy. And ProSci, a change management company that's done a lot of research in the area of change management, has identified that for leaders, the role of leaders in managing change is three main areas. We call them the ABCs of leadership: to be active and visible, to build a coalition, and to communicate. And they actually note that the single most important determinant of success in managing a change, especially that transformational change as the CMO was doing with his specialists, is to be active and visible. You can't just delegate to somebody and check the box and think that you've done your role as an effective leader of change. And so what we've done is created a set of tools that you can use to help guide your team through that transformational journey, at the same time to respect their autonomy. And let me share a story of, this is a great story of how to lead a team through transformational change. And it is a good example of what transformational change is. A number of our primary care practices struggle because of access. Patients want to be seen when they want to be seen, and the lack of access leads to increasing costs downstream when they end up in the emergency room or hospital. It leads to decreased patient satisfaction. So there's certain kind of untoward effects to your business and to your measurements as a practice and as a system if you're not able to provide access. And so one of the strategies is extended hours, to have the clinicians and their care teams be available in the early mornings, into the evenings, and even on weekends and Saturday mornings. Well, that's a significant change from a current way of doing things, a current mindset, to a future way of doing things, a future mindset. And it's a significant transformational change. And when you go through that, there's what we call the path to commitment. This is one of the tools. And the path to commitment begins by understanding kind of the awareness of what the change is, the extended hours, why we're doing it. Then the belief phase. Why is this important? How does this align with the organization's goals, the organization's mission and vision? And then the commitment phase, which is what are we actually going to need to do, hands on deck, to implement this program going forward in the next several weeks to several months. So it's the awareness, belief, and commitment. As a leader, you're trying to bring your team through those phases to ultimately get to a commitment to implementing this program, Extended Hours. What you'll find is, and most of us have experienced this if we've been leading our colleagues through this type of discussion, through this type of transformational journey, is that there'll be some who will be resisting. They will be actively resisting this change. And it's the challenge for us then is to respect their autonomy, or as we call it, honor that resistance. Knowing that resistance is not a bad thing, resistance is a normal thing, and there's energy in resistance. These individuals are not checking out, they're not choosing to be silent, they're actually bringing their voice to the table and expressing their concerns. And so it's an opportunity for us as leaders to learn how to respect that voice, to give agency to that voice, to give them a sense of autonomy, and in so doing, honoring that resistance. So the second tool that we use is a great tool to be able to do that. It's called the DVFR tool, and I'll talk through it briefly, but we have a whole workshop on this. And these are evidence-based tools, by the way. So what a leader would do is begin with the path to commitment to have sort of a pulse check. Where are you on this path? Are you at the awareness phase? Are you at the belief phase? Are you at the commitment phase? Or are you at the resistance phase? And you identify those individuals who are at the resistance phase, and you identify what are the concerns and issues they have. You begin to create that list, if you will, that are the concerns that our colleagues who are in resistance have. You begin to honor them, to give them a voice, to give them agency. In the process, then, you have a whole list of issues that you and your leadership team can address. And as I mentioned, one of the three components or roles of a leader in managing change is to build a coalition, the B. So you bring together your coalition of colleagues, key stakeholders who are supporting you in this change process, and you say these are the lists of issues that are that our colleagues are expressing who are resisting this change, and you begin to then think about how to strategize and address those issues of resistance in three ways. One is the D. What is the data around our current state that is causing us to move from this place? Maybe it's our ER utilization, the costs of care. Maybe it's the patient dissatisfaction. That's the another part of the D. You start to collect that information. The V is the vision. What's the vision of our organization? What does it look like in the ideal state as we go through this transformational journey? And it's a great way to capture that vision by a story. And there was a story, actually, as I did this workshop once. A physician was sharing, he had a patient who was a single mother that had some significant chronic illness and needed to be seen on a routine basis, but wasn't able to because of a risk of losing her job. She just couldn't take off during the normal working hours of the week. So when they provided extended hours, it was so relieving for her, because now she could get in to see her doc on a Saturday morning, get her medical problems and issues addressed, and not potentially put her job at jeopardy. So that story really captured the vision of that future state of what we wanted to achieve, and it resonates at the heart level and can be very compelling, actually, to helping people in resistance moving forward. So it's always helpful to think from a leadership perspective, what's the stories of that future state that we can try to capture? And then the F, the DVF, the F is the first steps, the actual project plan, the things that we're going to be asking for you to commit to. And as we all know, it's helpful to actually know, what are you asking me to do? What do you need me to do? So you can kind of clarify that. I said that the ABCs of leadership, the third one is communication. Well, the benefit of the DVFR, because R is resistance and DVF is data, vision, and first steps. If you can clarify the key components of D, of the data, the key story of the vision, and the first few steps of your next 2 to 4 weeks in a 3 to 5 minute vignette, a 3 to 5 minutes elevator speech, you now have a great communication tool. So when you're the leader going out to engage your key colleagues out in the field and sharing with them about this important role of transformational journey, you're number one, being active and visible. And as I indicated, that's the number one determinant of success for change, is you being out and being visible and active in this change process. And you're now beginning to address the areas of resistance that your colleagues have expressed by sharing that elevator speech. It's a great tool. It respects our colleagues and gives them voice and agency, gives them a sense of honoring their resistance by listening to them and addressing those issues in a very tangible way. So those are some great tools that we've developed. They're evidence-based, that I think are a great way of helping leaders be skilled and impactful in managing transformational change.
It also I don't know if my voice is okay. You could hear me well.
Yeah,
I
can hear you.
It also uses the self-actualization theory of needs. Going back to that, to the author you mentioned, Daniel Pink, when he says autonomy, mastery, and purpose. Well, it's another way of saying connectedness, relevance, and autonomy. And
Yes.
so it's when you have people who fulfill those three needs through those steps, then you are going to get the engaged individual and the less burnt out, and so on and so forth.
Exactly.
And so the key is to how to get people to do that. And you know, I'm a huge proponent, and I know you love coaching also. So I'm sure you provided the solution, but you also provided a key to that solution, which for me is the coaching. But can you talk a little bit about some developmental programs or coaching programs that you have used for that?
Yeah. It's great. We've had conversations with the University of Washington and their Quality Improvement Boot Camp, and I have a very similar program that I've developed. We both went through the Intermountain Advanced Training Program on Quality Improvement, where they basically gave you these tools, which is to help bring an organization and a team through a process, train the trainer, if you will, so that they can have these tools to bring back to their practices to improve programs. Another great train the trainer program that we've developed is a key driver diagram model. It's a offshoot of the model for improvement, and it's a way of implementing the model for improvement in a very interactive way with your team. We talked about change management and the importance of assessing your team at where they're at in the path to commitment. So there's a nice little workshop on the path to commitment as a readiness assessment and pulse check for your teams. And then learning how to address the resistance in a very effective and respectful way, honoring it, as I said, by using this DVFR model. So that's a great workshop as well.
I want to thank you for your time. I know we're coming to a close, so for the benefit of our viewers, let's give them a summary. Everybody likes, all right, what's the conclusion? Tell me what we're focusing on. So can we summarize the 3 points, the 3 takeaways that we talked about to our viewers?
Yes, definitely. So professional well-being of our physicians and their care teams is driven primarily by organizational culture and efficiency of practice. And as I indicated, you cannot manage what you cannot measure. So organizations who are committed to well-being of their physicians and care teams need to deploy validated survey instruments for both burnout and leadership effectiveness. And there are several evidence-based coaching and development programs, I've referenced a few of them, that can help your leaders and clinical care teams both to empower them as problem solvers and to learn how to honor the resistance of their team as they go through a transformational change process so that they can come to the other end as committed members of this change and really feel like they've been honored and respected in that process and have a voice and agency as they've been going through it.
Dr. Taylor, I can talk to you for days because all of this fascinates me. I want to thank you again for your time, for your expertise. And I know that this information is invaluable to people. For those of us who do watch this and are listening and have learned, today was the tip of the iceberg, but it provides a wonderful map for anybody who seeks change. You are a wealth of knowledge, practical knowledge, not just theoretical. And I love that. And I will certainly put your information if people want to contact you. So
yes, definitely.
So they can get also information and they know how to contact us. Again, thank you all. Thank you, Dr. Taylor. I can't tell you how appreciative I am. And until next time, hopefully we'll have you again because I have a lot to talk to you about. So thank you for your time.
Thanks, Naeem. Have a great day.
You too. Take care. Thank you.
Bye.